Hi, good evening. So today is World Sleep Day, and the second interview of the day is with Dr. Santosh Kumari. I know her as a dentist about 3 years ago, three and a half years ago, and I lost touch during COVID. And recently I found she has specialized into sleep medicine, and we will know more about it from her. Let me give you a quick breakdown about uh, her credentials. She's a MDS, MAAID, Implant Dentistry, American Academy of Implant Dentistry, Laser Specialist, Asian Academy of Laser Medicine, Orofacial Pain and Dental Sleep Medicines, a fellowship from New Jersey, Pediatric Sleep Specialist, and Myofunctional Therapy, Myobrace Research Center, Australia. And this was a godsend for me because from a doctor's perspective, and especially for children, how can we prevent children having sleep disorders later? Not just sleep disorder. The basis is because of that sleep disorder, so many other diseases can actually hit them and cut short their life also. So let me jump straight in and introduce Dr. Santosh Kumari. Good evening, Dr. Santosh Kumari.
Good evening, Ignatius sir. How are you?
Super. And I'm so glad we connected again 2 days back. And I discovered this so that we will be able to take it
Even
to
I
people.
I was also looking somebody, to do some program on the World Sleep Day because it means a lot to me and I've been doing a lot of things regarding it. And as a dentist, I want to change life of people, and create more awareness that how quality of sleep is getting hampered in the little ones in today's generation.
Yeah, that's what we love to hear. Can you tell us your experience? What was the journey? How did you enter sleep, and what have you found?
See, it has been the journey started like I would say when my daughter was born, who was a very difficult child. She would have repeated ear infection all the time. She'll complain of ear pain, and she was a very, very fussy eater. Her quality of sleep was very bad. She would just wake up now and then. That time and she had multiple dental caries. In spite me being a dentist, I never gave her any chocolates or things, and I was very precautious being a pediatric dentist. In spite of all this, she developed dental caries and the other issues which I am telling about, and I didn't know why it was. I was thinking, okay, she has ear infection or she's a poor eater, all these is. But as I went ahead, then when the pandemic happened, a lot of seminars and webinars I attended online, and I came to this field where I was introduced to orofacial myofunctional therapy. A lot of dentists in abroad, especially pediatric dentistry, were talking so much on the sleep disordered breathing. And when they were telling the symptoms, it struck me that my daughter also underwent all these symptoms. And then I started going deep into it. I did my specialization. I also did my, super specialization with Myobrace, Australia and MRC, and went into the sleep disordered breathing, where then I was able to connect the dot that all these symptoms which I see regularly in my practice is related to poor quality of sleep. And as dentist, I was not aware of, then how will a young individual will be aware of. So then I did my specialization. I found out how sleep can affect or change the form and function of an individual. It could lead to malaligned teeth and other things. That is how I came into it, and I've been practicing it for past 2.5 years now, creating awareness among the parents about this condition called as sleep disordered breathing in children. And that's how my journey started, and it's an ongoing journey. I'm still reading and I'm still getting things into it, but yes, that's how it started off.
Awesome, Dr. Santosh Kumari. So, as you guys know, when we discuss about sleep, we discuss three things. One is timing, second is duration, and third is quality, the satisfaction you get in the morning. So, timing and duration is under your control. I mean, at least timing is under your control. Duration, if your sleep hygiene and other things are right, you might get that 7 or 8 hours sleep. What's more important is quality of sleep, the satisfaction. How do you wake up in the morning? And this is where Dr. Santosh Kumari comes in. And there are some physiological conditions which happens at the jaw level, which compresses the she'll give the details of what is the trachea, what we call the airway. So the airways get constricted, and then we end up breathing through the mouth. That's how snoring happens, and then it leads to sleep apnea and so on. So I mean, this was a revelation for me. Okay, when I heard it from her that there could be a physiological condition, okay, because of various habits. So as she says, food habits, the way we have developed over the last 200, 300 years. And so we've reshaped the structure of our jaws, mouth, and so on. And she'll give more details on that. And that is affecting later in life. All the conditions of blood pressure, diabetes, hypertension, I mean, you name it, there are a lot of medical and lifestyle diseases. The root cause being that they could not sleep well, they couldn't get enough oxygen. And that is where she comes in. And there are solutions. So you don't have to take medicines. There are ways of getting it. And that's what I discovered. I wanted to share it with us because she's done some amazing work in the last 2 years. And so let's quickly, we have just half an hour. So just hang on. Let's hear from her what she discovered. What are the diseases, or I mean, how does sleep apnea come, and where does it lead to? If she could tell that, because that's really the core. Snoring, what is snoring? What is sleep apnea? What's the difference? And where does it lead to? So I've asked 2-3 questions at the same time. I'm sure you'll be able to take it from there. Yeah.
Okay, so most of the time, you can see people snore around you, and you think, okay, because the individual is in deep sleep, being tired throughout the day, so they are snoring. It's not like so, snoring is never normal. Snoring is abnormal. Because when you snore, why does the snoring happen? Imagine you have a face, you have a nose and an airway space and a tongue. So when you are at rest, when you're at rest, your tongue always compresses your upper jaw. It forms a natural suction in your palate. So that is how it happens during the sleep also. But if you have a jaw which is very constricted, or your midface was not grown well, or you had issues with braces early in your life, or your tongue had restrictions, So when you're sleeping, what happens is the tongue collapses into your airway space. So when that collapsing happens, now you have one pipe right behind your face, the mouth is here, right? You see, this is the face, right behind her, you have the trachea. So when you're sleeping backwards, the tongue is collapsing into the airway space, and that leads to obstruction in breathing. So it leads to snoring. Now, every snoring is not a sleep apnea. I want to remind you, so anybody who snores or everybody who snores is not a patient who's a sleep apnea, but every sleep apnea starts with the snoring. So the first step into sleep apnea is snoring. And majority of this time, what happens, people think, oh, my partner is snoring, my dad is snoring, my father is snoring, my brother is snoring, it's normal and it doesn't affect your health. No, snoring, once it collapses the airway, second, it does not let the absorption of oxygen that is required for your brain to go into a deep sleep. So when you have an airway which is like that, and you have the tongue which is collapsing, now what this is doing is indirectly sending signals to your brain saying that the individual is dying. So what is the brain trying to do? It's trying to awake you up, wake up, you're not breathing. And suddenly they get up with a jerk and they start snoring, So there is a snore, there's a pause, there's a slow. So all this indicate that the oxygenation to your brain is decreased. You are not able to go into a deep sleep state, that is required for your redevelopment or rejuvenation of muscles and for your health improvement. If you cannot go into a deep state of sleep, your body is not rejuvenating, then you develop symptoms which are associated with lifestyle, like blood pressure, diabetes, and other health related issues. And you try to correct those things without knowing that the quality of sleep which is hampered, and that is why you're leading to the other lifestyle implications. So sleep apnea increases the risk of other lifestyle diseases like your diabetes, your blood pressure to multifolded, And if you can correct your sleep, when I say quality of sleep, it is not sleeping 7 hours or 8 hours a day. It is even if you sleep 6 hours, you should be able to complete the full cycle of sleep from stage 1 to stage 5. And only in deep sleep state, the body starts rejuvenating. So that is why it is very important that you have a good quality of sleep.
Awesome. Awesome. But I've heard this snoring thing, okay, because I personally used to snore quite a lot. And then this is about a few years back. After losing weight, I found that because I heard that it could be a fatty growth. This is what I heard at that time. Okay. What I heard from you yesterday and day before yesterday were very, very different. I mean, so you gave a scientific, you showed me images of, what happens when the tongue falls back and what happens when we breathe through the mouth and then it inflames the adenoids, you call it adenoids, right? And so it makes it worse for more difficult for air to flow through the nose. And so we get into all these other issues. So this I've learned now, but before that it was more about fat. I mean, you lose weight.
So,
so what is
point,
that?
what you're telling is also right. So if you don't have a good quality sleep, you will develop lifestyle implications like diabetes and all that, and you will start gaining weight. So when you're gaining weight, airway is not a thick, bony pipe. It is a soft, flexible pipe. Imagine you have a rubber-like tubing. So if you are putting on weight, you have something called as neck circumferences we measure, and the neck circumferences should supposed to be below certain reading for you so that the pipe is not collapsing. Now, if you're gaining weight, the first area where you gain weight is in your neck area and this area. So when you're gaining weight, it also collapses your airway space. And if you have other implications like a small jaw or a tongue which is larger and it is falling into the airway, it again increases the risk of sleep apnea. So yes, changing the lifestyle modification or losing weight will decrease your snoring or sleep apnea very much. But then you also have other things that needs to get corrected. Mild to moderate snoring, all these lifestyle changes, reducing weight, doing some airway exercises can help you stop the snoring. But if you have a sleep apnea, which is very moderate to severe, then you need to have more interventions that is required from medical point of time.
So is there some kind of test that people can take or questionnaire or whatever that which will help them know whether they have sleep apnea, or do they have to come to a doctor, or do they have to go to a sleep study? How does somebody find out?
There is a very, very simple questionnaire which is available online. And yes, there are tests which are available and they cannot take the test by themselves. They have to go to a sleep specialist or a dentist who specializes in sleep medicine. They will prescribe you something called as polysomnography or sleep study. Now, this sleep study will have 3 readings. That is, has the wavelength of how your brain is functioning, how your heart is functioning, and how your lungs is functioning, and what is the muscle tonicity during sleep. So all this gets measured during your sleep. It also checks the amount of oxygen that is supplied to the brain during the sleep. So it checks your partial oxygenation to your brain. And you will be surprised that people who think they are very, very mild snorer or not snoring that much could have these readings. And then it is divided into, AHI score. It's called as the apnea hypopnea index, which will range from 5 to all the way till 45. So based on this calculation, it can be mild, moderate, or severe. And based on this reading, a dentist or a sleep specialist or a pulmonologist or an ENT who specializes in sleep will be able to guide you as to what modality of treatment is better. If you fall under the category of mild to moderate, you will be pretty much be able to get over it by doing the modification, the lifestyle changes, reducing your weight, following proper sleep, reducing your stress. All these will reduce your AHI score. But if you're falling from moderate to severe, then yes, you will require a medical help along with the other lifestyle changes which is given to you.
Okay. So at the first cut, is there a questionnaire? How do they reach you, or how do they just Google it and get a questionnaire and do it? Or how does it?
They can Google and get it, but it is too complicated. It is always better they reach out to a medical health professional who can guide them through the questionnaire and do the evaluation.
Right.
Not only that, they will also examine the airway space, they will examine the jaw, the tongue, and how the adenoids and tonsils are is their Mallampati score is normal and all these things. Once they evaluate you on those grounds and have a questionnaire with you as to what are the stress in your life, then pretty much they will help you to get the sleep study done. That is how you can lead to a proper conclusion whether you have sleep apnea or OSA and what level you are getting, the scores.
Okay. All right. So other than a master health checkup, each of us should also do this to check whether because I don't think in the master health checkup they find out whether you have sleep apnea or.
Yes.
Right?
See, in India, it is still an evolving science unless you go to a doctor saying I'm not having good quality sleep. I've been sleeping in the day. When I drive, I go to sleep. I find it very risky. And that is when the doctor, will prescribe you the sleep study test. Till then, it is not a mandatory test. So there will be times when this is going to become mandatory, but then till then, yes, you will have to look out for the signs and you will have to reach out to the physician or the medical health professionals for you to guide them to get sleep study done.
Cool. So guys, I hope you heard that. I mean, from what I'll just recap what you said. If you are aware that you're feeling tired when you wake up, or if you're feeling sleepy while driving, or you're listless, you're tired during the day, these are all signs that your quality of sleep wasn't good. Okay, so you might have slept 6, 7, 8 hours, but if you don't feel fully present the next day, that means the quality is somewhere compromised. And then it's good if you go and get it checked because it could be fatal. As you already know, some people don't get it checked. They do everything else. They take care of nutrition, exercise. They have the discipline, the regular, everything they put into place. But because they've not checked this is a silent killer which lies under, and then it knocks you down. So it'll be good if you watch out for these signals. These are the key signals that you're feeling. Can you repeat those signals?
Yeah, see, you will have morning headaches, you will feel drowsy and lethargic throughout the day. You will get up frequently for urination. You will have grinding or clenching of the teeth in your night, and your dentist can say that you're brexing in the night time. Even having good quality of sleep, you will not feel fresh in the morning. You will have dryness in the mouth in the morning. And when you're talking to somebody, all of a sudden you will just doze off, or you're driving a car, you just doze off. So these are some signs and symptoms that there are possibilities that you are suffering from something called as sleep apnea, and you need to get it checked.
Okay, great. Thank you so much. So, but snoring, I mean, coming back to snoring, because so many people snore, right? You did say that snoring doesn't mean you have sleep apnea, but always sleep apnea starts with snoring. Okay, so at what stage do people have to start like worrying or, taking some action?
See, snoring itself is never normal. So if you have snoring, you must get yourself evaluated, do the lifestyle changes, what is required, and get a sleep study. So you will know if you have sleep apnea or not. If it is mild to moderate, as I told you, simple lifestyle modification, getting your hygiene corrected. There are simple exercises to strengthen your airway space. All these could help you to stop the snoring. If you have the other, from moderate to severe, then definitely you will have to meet a healthcare provider to get your things sorted out. So if you have snoring, then it is, a risk sign which you'll have to watch it out for, and you must get yourself evaluated.
Super. And for kids, I mean, I know that you specialize in kids. So how early does snoring start? Do kids snore? And if so, at what age? And how do we, prepare them to have a life where they don't have those kind of complications later?
So I have children in my practice, who comes with frequent complaint of saying my child is grinding the teeth in the night. They are brexing it, they're clearly clenching it very hard. We can hear them sleep, the sound even we are sleeping next to us. And for children, snoring is very, very common. I have seen children as young as 1.5 to 2 years snore because their jaws are very small, the airway space is very small, the tongue can get easily collapsed. So these are the things, if you have a child who has been sleeping but still gets up cranky, gets up in the night frequently, doesn't go to a deep state of sleep, who keeps rolling on the bed, every time, bed wets, they have frequent infections like, ear pain, uh, frequent airway infection like inflamed adenoids and tonsils. And because of this repeated infection, they start sleeping with mouth open. So that will again lead to poor quality of sleep. Now, this mouth breathing or, sleeping with open mouth has become a major drawback, or I have seen in many children that, see, the nose is meant to breathe, the mouth is meant for eating. Now, if you have repeated airway infections and your nose is getting blocked, the nature will find its way to, get the air for your body, which is required. So what will the child do? The child will start sleeping with mouth open. And when they sleep with mouth open, the tongue function is not happening properly. Any normal child who sleeps will have the tongue always glued to the roof of the mouth, the lips are sealed, and they sleep through the nose. So this is a normal physiological pattern. The moment the nose is getting blocked due to infection or various other reasons, they start breathing through the mouth. Now, this mouth breathing, grinding the teeth in the night, sleeping with air, with mouth open, all these are signs that the quality of sleep in individual is hampered. So it will change the cognitive behavior of a child in the morning. So the child will be very irritable, cranky. They will not sit in a place, they will keep moving around, and you will find that the child is very difficult to handle, and you will see that your child is very calm and doing all the work properly, but your child has difficulty in learning. Sometimes they also, you take the school says your child is special, child is suffering from attention deficiency syndrome, ADHD, but it actually not be an ADHD. It could be that the quality of sleep is hampered and the child is having a symptom called a sleep disordered breathing. So you will have whole lot of these symptoms which a parent can very much relate to. And the moment you correct, because they are young, you can retrain them very fast. The moment you start training them or looking out for symptoms, you will be able to see the change. If the quality of sleep is, you can improve them.
Awesome. I mean, this is quite a revelation. Okay. So, I mean, anyone who knows of a child with ADHD or hyperactive, whatever, you could probably just take the study to see whether it is because of low sleep quality.
Hyperactivity, I'm repeating, hyperactivity, ADHD, repeated cough and cold, airway block, repeated, you're taking the child repeatedly to an ENT, ear infection, the child is always rolling in the bed. Never, they wake up with a drop of a pin. Say my child will just wake up if there is a pin drop, even a slightest of the sound. And if they have bed wetting, all these are symptoms that your child has a condition of sleep disordered breathing and they require help.
Okay. Okay, that's a eye-opener. But you started with saying that grinding of the teeth. Okay, so I remember when I was a kid and my dad was a homeopath, and so he used to say, I mean, he may be totally wrong now based on what you said, that it is, I mean, not just my dad, grandparents and all say there are worms in the stomach. Deworm them, then they will become okay.
See, that is also one of the reasons for grinding. But even after deworming the child, they will continue grinding the teeth. Right, so that is not only grinding, you will have the other
all the other symptoms. Yeah. No, but that kind of
so after deworming also, if you are grinding, deworming is one of the things that will lead to grinding your teeth. But even after deworming, if they continue grinding the teeth, if they have issues with the cognitive development, and then the parents has to look out and reach for help.
Understood. So basically, you can evaluate and find out whether they need help, right? That's what.
Yeah. So what I can do, Ignatius sir, I could share a slide, which could be, that these are the 10-15 signs and symptoms which you can look out for poor quality of sleep. Or to find out the child has got sleep disordered breathing, and if they have, so then the child requires help and they should reach out to a pediatric dentist who specializes in sleep for the help.
Okay, and you are in Chennai, so physically they have to reach out, right? This is not something you can do online or.
No,
Is
we
that
could
possible?
evaluate the child online, and we could give these. This is more like an exercise therapy called as myofunctional therapy, which we can support through online or Zoom. So, it is pretty much, if the parent is inclined, we will be able to support online also. I have children right now I'm treating, who's in Germany, Singapore, and Australia. We tell them the therapy, we guide them, we also courier the materials which is required to retrain the breathing, the swallowing, and the facial pattern, so that they get the quality of sleep better.
Super, super. So any idea how many kids, I mean, what ratio of kids, percentage of kids, have this condition?
In Western world, they say 8 of 10 children have sleep disordered breathing, but in my practice, I at least see 50%. And now I have to make it mandatory that every child who enters my practice has to fill in the sleep disordered breathing questionnaire, and I screen them. And I will pretty much be very surprised when I started 2 years back, and I introduced this to my practice. I was so surprised that 50% of the kids are falling into this category.
My God. And by catching them early or ensuring that they stay healthy for a longer time, and the development, their whole physical development comes out right. They won't have the future problems by correcting it.
What I'll have to emphasize is the craniofacial growth. That is the growth of a child. Brain starts developing by 7 to 8 years. Your facial structure and the airway space stop developing by between the age of 10 to 12. That is the age when we can do the correction. You can align the muscles back, do the breathe retraining exercises, and also do the myofunctional therapy. Post which it is only adaptation. You cannot grow the airway space, you cannot grow the jaws and all that, and then you will have to someday, do a midway to correct them. But right age, you want your child to be cured, it should be always, before, the sooner is the better. Before 10 years is when we can treat them wonderfully, but post that, then it is the results are not that great.
Super. So from what I understand, these conditions make them not sleep properly, and then it leads to further conditions and complications, right? So it's not that because of bad habits they don't sleep properly. I mean, bad habits meaning in terms of regularity or timing or distractions and other things. So it's not that which causes this. There's a physiological issue caused by the way they eat.
That can also be the reason, but one of the main reasons is they have some airway obstruction that is causing them this issues.
Okay. Super. That's a revelation to me, and I'm sure I will. My other programs, I'll be able to bring it out to others so that they catch it early, because otherwise we are normally always working after the problem hits us. So if you're able to prevent the problem, it's really, really good. Thank you so much, Doctor. And how do we reach you? How do the readers reach you?
You can share my contact details and my mail ID at the end of the program. So in case if anybody is having children or adults who have sleep issues, they can reach out to us. We can have a consultation session with them. I can provide them a complimentary consultation session initially, so that we can help the child. Super. Pretty much that way you can reach out.
Super, great. So if you share that, I can share it along with this video so that the readers, the viewers would be able to, reach out to you. Is there any questions you would like to ask or anything else you'd like to share with people on?
Yeah, what I would like to ask, as a medical practitioner, I know on the medical side how we can help. As a deep sleep coach, how are you able to, help these individuals, because for us, it's always a physiological obstruction or the airway obstruction, which is causing them the sleep apnea issue. And that is the quality, and you correct that, you fall into.
Correct.
But how are you able to, address these individuals?
So, yeah, very well asked. So what we do is, as you earlier told, it's about timing. What time do you get to sleep? What duration do you sleep? Finally, is the quality of sleep. So quality of sleep is what you've addressed right now. The timing and duration is because of our habits, our behaviors, the way we think, what we believe. Based on these, we adopt certain habits which kind of backfire later in life. Let's say in college, you're staying in a hostel. you'd love to stay, sleep at 3 in the morning, 5 in the morning, and things like that. And then it becomes a habit over time. And then when you actually want to sleep, you're unable to sleep. So there are people who come to us who have not slept properly for last 10 years, 20 years, and so on. So it's about shifting their belief systems, helping them to adopt the right habits so that regularity comes. And then about sleep hygiene, the conditions for right sleep in terms of temperature, light. So nobody's taught us sleep science, neither in school nor in college, and I'm sure not even in an MBBS or MDS program. You have to do a super specialty to learn about sleep. So they don't teach us in any of our regular things. And that's something we do 1/3 of our life. So we have spoiled our habits. And so we don't get the sleep when we really want it. What you have shown us is because of the way we eat, exercise, live, we've also physiologically brought about some changes, which again is contributing to loss of sleep, loss of proper sleep, let me put it, and because of which other disease conditions starts happening. And so I think both are needed. Now I'll include this part, this knowledge which you've shared, I will be able to share it with others because people don't know. That is the whole issue. Because they don't know, when they actually have a problem, they face with it and deal with it. But sometimes it's too late. I jumped in because
majority of the time when they reach out to us, the boat is already sinking. They've gone way too ahead that for us to bring the reversal, it takes some time. It's not going to happen overnight.
Yeah.
So yes, the first thing, if they are snoring, they have to get themselves tested or visit a ENT specialist or a person who specializes in sleep medicine or sleep dentistry, and they would be able to guide you as to how you can take it forward.
Correct. Now, if I'm sleeping alone, would I know I'm snoring?
You have very good apps on Amazon.
No, I get it. There are apps.
Snore Lab.
Yeah, I've seen
you
those
can
apps.
Switch on the Snore Lab and you can analyze yourself, you're snoring or not. This is a very good app. It tells you you're snoring or not. So this is one way you can find out whether you're snoring or not.
Okay.
But if you're snoring, it is never hidden. Somebody or the other will tell you that if you're snoring. So it's very easy to make it out.
Okay.
Unless you are an occasional snorer, but if you are a regular snorer, it is easily you can easily.
Yeah. What I like to know is if you are snoring with or without your knowledge, it doesn't cause tiredness in the morning the next day. Which case, because I know I feel tired, I could check whether I'm snoring also. Can it work backwards like that? Is it something?
See, sometimes the snoring is just a harmless snoring and doesn't affect your health. But I have individuals who have severe. Last month also I had an individual whose jaw was very constricted and he was a loud snorer. In the daytime also he used to snore. And he said apart from snoring, he is pretty much fine. He doesn't have any of the symptoms and signs which we expect in sleep apnea, So physiology will never present by the textbook. The textbook says A, B, C, D. Your body will never react like that because you're a human being. You're not a experimental thing. So he just had snoring, and I said, okay, fine. Let's do one thing. Why don't you get your sleep study done? We will find out the level of pain, and based on that, we can work together. And to my surprise, because his jaw was very constricted from the young age, he had a very small jaw. It was back. He had malaligned teeth. All had led to a very, very constricted airway. It was only this size. So he was in a store where he had severe sleep apnea to a condition where he will require the assistance of a sleep apnea machine. So sometimes it is very difficult. The body is very good in adapting. It will adapt. 10 years, you will not have problem. As you age, no longer your body is able to adapt. This is when you start seeing the symptoms. So if you're having symptoms today, doesn't mean your sleep apnea started yesterday. It would be way back.
Got it. Okay, thank you so much. So any last words for the audience so that they can be more aware and take action early.
Guys, yes, so look out for these signs and symptoms which Ignatius sir is going to share with out, especially in children with regards to sleep disordered breathing. Because as a parent, you could help these growing children to have a better future, better developed jaws, so that they don't fall into the trap of lifestyle diseases earlier. No, initially when you had heart attacks, health related issues, post 50, as you grow, it is the condition are coming way much ahead, 30 years, 20 years, you see lifestyle diseases. And if the airway which you can really grow now, you know this is the cause, and you have a treatment available, let's be proactive and help our coming generation to have a better future and have a better life. Rather than get the treatment post, you see the okay, now I have the problem, let's treat it now. Where you can physiologically grow the jaw, correct the airway space because it can be corrected. You know the science behind it. You can help your children better.
Thank you, Dr. Santosh Kumari. So guys, please look at the slide which I'm going to share soon after this, at the end of this video. Please look at it and make sure that you take action early, because this is not something that we can act on when it hits us. Okay. So thank you all so much. And thank you, Dr. Santosh Kumari. You're a really busy dentist, and I'm so grateful that you were able to come and share to everybody here. Thank you so much.
Thank you, Ignatius sir, for this opportunity. And I was glad that I could connect with you. And happy World Sleep Day to all of us who's been watching this program. And watch out for your sleep. It is very important.
Thank you. Happy World Sleep Day, everybody.